Let me bring in now Rick Gates, Senior Vice President of Pharmacy and Healthcare for Walgreens, now getting stores ready to start helping states with vaccinations at nursing homes, probably starting within the next week. He's also working ahead on plans for when the vaccine becomes available to the general public. Rick, thank you for being on the show. Good morning.
It's great to be with you. Thank you for having me.
So let's start with those plans to help states vaccinate people at nursing homes and assisted living facilities. That starts, I think, December 21st, basically less than a week from now, right? What does it look like?
Yeah, so obviously we've been working closely with Operation Warp Speed and with the states and CDC to really plan this out. We have about 35,000 long-term care facilities and skilled nursing facilities that have actually chosen Walgreens to be an administrator for them. And we've been actively working with the states and long-term care facilities to start to plan those out when vaccine does become available for Walgreens starting on the 21st. To start to get out into these long-term care facilities and start to vaccinate both the residents in that facility as well as the healthcare workers and staff at the facilities as well.
Are there any, I guess I could say, lessons or anything you're seeing or learning from over the past 24 hours, day one of this national rollout, that could change things for you moving forward?
You know, I think that what we're trying to ensure is that we understand the inventory that we're getting so that we can plan appropriately to get out to long-term care facilities and vaccinate the entire staff and residents within those facilities. And then as we have more available, obviously we want to accelerate that into the week so that we can vaccinate more Americans more quickly, obviously. There are certain states that have Pfizer as their choice of vaccines. So those are the ones you'll see us in earnest working through next week. States that have chosen the Moderna vaccine, we still are waiting for EUA approval to have vaccine available for long-term care facilities in those states specifically.
That is set to come potentially as early as this week. So I imagine that process will kick into high gear when that happens. What about for other Americans, Rick? The vision for when the vaccine does become more widely available. Dr. Fauci said on this show yesterday that he thought that was going to be maybe March or April in that time frame. At that point, are people like, you know, healthy Americans able to walk into a Walgreens down the street from where they live and say, hey, I'd like a vaccine? Do they have to sign up in advance? Do you think that timeline is realistic?
Yeah, I think that we'll see, quite honestly, when we see production ramping up and if Moderna is actually approved. If that's approved, the ability to get more vaccine into our hands is going to be increased, obviously. So they're saying that the vaccine should not stop being pushed until we get past full vaccination for long-term care facilities. But it still comes down to the states, and the states will determine which priority populations we would be vaccinating. And so even early vaccines that may be available for general public, we still will determine with the states what those priorities are, and then we will have ways to ensure we're vaccinating the right individuals, as well as signing them up for inside, or they will actually schedule appointments, if you will, as well as schedule ultimately the second series completion dose as well. So we will still come at it from a very calculated way initially until broad vaccine is available that we could go, to your point, and expand it beyond those prioritized populations.
What about your own staffers, Rick? They're going to be the ones who are having to be in Walgreens stores and different facilities, you know, helping with the administration of the vaccine. Are you concerned about having enough staffers? We know that there are some people, most people actually need to be monitored for something like 15 minutes at least after getting the shot. That obviously takes a lot of people and a lot of resources.
You know, it does. And I'd say for phase one, especially with long-term care facilities, we have been planning for months, for this. I would say that from a staffing perspective, understanding the teams of the pharmacy teams that we need to go to long-term care facilities, we're confident that we can do this. We've been doing off-site clinics for long-term care facilities and others for forever, you know. And so I'd say that we've done 150,000 over the last 5 years. We know what we're doing here, and I think that we'll continue to have that process in place to ensure that we have safety protocols as well as the time that you're referring to ensure that there's no adverse reaction to the individuals that are receiving the vaccine as well.
Thank you for checking out our YouTube channel. Why don't you subscribe? It's really easy. Just click on that button down there. And for more news from MSNBC, click on any of these videos here for the latest interviews and highlights. You can get more videos from MSNBC with our newsletters. Head over to msnbc.com/newsletters to sign up.